Our case study challenge is on celiac disease. 1 in 100 North Americans are diagnosed with celiac disease every year. Gluten in foods can cause the body's immune system to attack cells in the small intestine. Celiac disease is incurable but can be managed through a gluten-free diet. With a gluten-free diet, you must avoid ingredients such as wheat, barley, and rye. If consumption of gluten occurs, symptoms such as anemia, loss of bone density, stomach pain, headaches, and fatigue can occur. A delayed diagnosis can lead to damage of the small intestine and stomach, leading to other medical complications. Many people have heard of someone having a gluten intolerance, but many don't realize that celiac disease is different from just having a gluten intolerance. 1 in 10 people with a gluten intolerance have celiac disease. When having a gluten intolerance, you can consume small amounts of gluten or be exposed to gluten, whereas if you have celiac disease, a small amount of exposure or consumption of gluten can stimulate the villi in the small intestine, causing painful symptoms.
Gluten is broken down to gliadin, a protein which is found in the stomach. The model shown here is of the 1-JK8 molecule. This molecule is formed by 2 human leukocyte antigens, DQA1 and HLA-DQ1, and insulin. According to NCBI, HLA genes are mapped on the short arm of chromosome 6. HLA codes for glycoproteins vital to antigen presentation and self-recognition by immune cells to form 1-JK8. The 3 molecules bond through peptide bonds. HLA plays a large role in the hereditary susceptibility of celiac disease, but is not the only factor in the heredity of this disease, therefore suggesting other genetic factors play a role. Another role in celiac disease is a 33 amino acid peptide component of gluten, which triggers an immune system attack. When a patient presents symptoms of low iron or anemia, a blood test may be ordered as well as a biopsy of the stomach and upper small intestine. This is a picture of a patient's upper small intestine who is diagnosed with celiac disease. It is important to note the redness, inflammation, as well as the irregular shape around the edges. Although it is incurable, there are many people with celiac disease living normal lives through committing to a strict gluten-free diet and consuming vitamin supplements to offset any nutritional loss before diagnosis. Although it is a chronic autoimmune disease, it is something that can be managed.